The nation tonight has marked a new watershed moment in the COVID-19 pandemic. 500,000 confirmed deaths. It comes even as daily increases in infections and deaths have slowed sharply in recent weeks. William Brangham reports.
500,000 people gone. It's been almost a year since the first known death from COVID-19 was recorded, and the country is reckoning with yet another horrifying milestone.
I think that when history writes this, we will understand that the mortality related to this pandemic is far greater than the numbers that we have been counting.
It's a staggering toll that seemed unthinkable even a year ago, even to many of the country's leading health experts. Projections last March from Dr. Deborah Birx, then the coordinator of the Trump administration's coronavirus task force, barely touched today's reality.
100,000 to 200,000, and we think that that is the range. We really believe and hope every day that we can do a lot better than that.
Dr. Anthony Fauci, the president's top medical advisor on the pandemic, said today it didn't have to be this bad.
We've done worse than most any other country, and we're a highly developed, rich country. But, it's so tough to just go back and try and, do a metaphorical autopsy on how things went. It was just bad. It is bad now.
It took only 3 months for the U.S. to reach 100,000 deaths. September and then December marked the next benchmarks. And in just 5 weeks, another 100,000 by January 19th. Just a month later, and today's total is roughly the population of Kansas City, Missouri, or Atlanta, Georgia, all gone. The Washington Post calculated that if all those people boarded a caravan of buses lined up, they'd stretch almost 95 miles long. That's a line of buses, bumper to bumper, between Philadelphia and New York City, or San Jose to Santa Rosa in California. As the pandemic has progressed, people have struggled to visualize the catastrophic losses from the virus. In memorials, from murals in hard-hit Latino communities to a candle lighting ceremony at the National Mall, have marked moments of mourning across the nation. Another ceremony and a moment of silence commemorated the tragedy at the White House tonight. Flags on federal property will fly at half-staff for the next 5 days. For the PBS NewsHour, I'm William Brangham.
As the country marks another tragic milestone, vaccinations are increasing. That leads many to believe we are beginning to see more light at the end of the tunnel. But questions remain over how long it will take before life returns to a safer and routine normal, and if new COVID-19 variants could throw off timelines even more. We explore these questions with Angela Rasmussen, a virologist at the Georgetown Center for Global Health Science and Security. She joins me now from Seattle. Dr. Rasmussen, welcome back to the NewsHour. This is a sobering moment, but as we say, vaccinations are increasing. You've written recently that you might think of this as climbing out of a deep well. Does that still apply?
I think that it does. If you look around, if you're in the process of climbing out of this well and you look around right now, it seems very grim. You will see only darkness. But if you look up, you will see a circle of light as you get closer and closer to the top. As you climb, that circle will get bigger and bigger. And that's the circle that we are climbing towards through vaccination and through the exposure risk reduction methods that we all should be continuing to apply. The more of those that we can apply, the more people that we can get vaccinated, the quicker we are going to be able to step out of that well and into the light.
Can we say that the worst is behind us in terms of hospitalizations and deaths?
I really hope so, Judy. I have been reflecting on this grim milestone that we've just passed. And what's the most heartbreaking to me is that the majority of these deaths were preventable. Now that we have really, really effective vaccines that have really exceeded our expectations, we also have the ability to continue to take these precautionary measures to further reduce transmission. I like to think that we will be able to prevent more needless deaths from this terrible virus.
And how worried should people be about these new variants, especially the ones that we hear the vaccines may not be as effective against?
So people should be concerned about the variants, but it's really important to tell people not to panic about the variants because these variants, while they may be more transmissible, while they may be less protected, or the vaccines may be less protective against them, we still know that they are transmitted the exact same way as every other variant that's been circulating since the beginning of the pandemic. Because they're not incredibly prevalent in the US yet, we have the ability now to really double down on those precautionary measures. So, masking, physical distancing, avoiding gatherings outside your household, washing your hands, increasing ventilation if you can. By taking all of these measures as often as we can, as frequently as we can, in as many situations as we can reduce transmission of those variants as well as the variants that are already circulating in our communities. Overall, that means we're going to be able to vaccinate more people and stop the spread of those variants in their tracks. So it's really important that we all really double down and remain extra vigilant until we can get vaccines distributed to more people.
I mean, you're touching on exactly what I wanted to ask you because, of course, many people who haven't had the vaccine worried, concerned about getting the vaccine. But then once people have the vaccinations, then the question is, how much longer, how long do I have to keep taking these same precautions we've been taking?
That's everybody's question, Judy, and that's my question as well, because nobody, I can assure you, is more tired of this pandemic than virologists, epidemiologists, and public health professionals. I would say to everybody that the sooner you get vaccinated, the sooner your loved ones get vaccinated, and the more you can apply these exposure reduction methods to reduce transmission in the community, the faster we're going to be able to relax these restrictions. I think that if we are all diligent about this and if we all get our vaccines when they are made available to us, we should be able to actually potentially even have a great relaxed summer. That's my hope.
And what exactly does that mean?
That means that we might be able to resume indoor dining. That means that we might be able to get together with our family and friends outside of our households. That means we might be able to have people over for the 4th of July. We will be able to get back to some of the quote unquote normal daily activities that many of us took for granted before this pandemic started.
Dr. Angela Rasmussen, we all certainly fervently hope that's right, especially on this day when we are reflecting and remembering the many, many lives that we've lost. Thank you so much for talking with us.
Thank you, Judy.